Good day, ladies and gentlemen. My name is Ms.Barona and I am the moderator of Group 6 today. You will be hearing a presentation from Group 6 on this very timely subject. But before we get started, I wanted to take a few minutes of your time. Since the start of COVID-19 outbreak, WHO has worked with countries and areas in the Western Pacific region on public health measures to slow or stop the spread of the virus. Safe and effective vaccines are an important tool in combination with other measures to protect people against COVID-19, save lives, and reduce wide-scale social disruption. Countries and areas in the Western Pacific region have already completed regulatory approval and started introducing one or more COVID-19 vaccines. Our debate title is Mandatory of COVID-19 Vaccination Deemed as an Ethical and Legal Action for National Safety. Let me start by commending the Parliamentary Assembly for your commitment to keeping the COVID-19 pandemic response at the top of national agendas. I also commend the report under discussion today for its emphasis on international cooperation for the fair and equitable distribution of vaccines, which was echoed in the Council of Europe's recent statement. And I commend the resolution we will discuss today, which recognizes COVID-19 vaccines as a global public good. It is in times of crisis such as this that our higher principles are most important. This pandemic has tested us like never before and now, even as we have developed vaccines in record time. It is testing us again. Vaccine equity is not just a moral imperative. Ending this pandemic depends upon it. Ladies and gentlemen, may I have your attention? Before the presentation begins, allow us to introduce the debaters. On the side of affirmative, we have Kimberly Ogsila, Ms.Mangaring, Joshua Tana, and Geraldine Acid. And on the negative side, we have Catherine Cutaran, Rally Gercan, Ms. Garcia, and Alexander Fernandez. Without further ado, let's start. Mr. Fernandez, the floor is yours.
Since the start of COVID-19 outbreak, many people are unable to return to their jobs and they are quarantined in their home and cannot go to the other place that they want because of the virus that is spreading. The only way to return their jobs and to go where they want is to take a safe and effective vaccines. In today's time of pandemic, vaccines are an important tool along with safety measures to protect people against COVID-19, save lives, and reduce a wide-scale social disruption. Back in 2020, the pandemic COVID-19 strikes hard the economy of the Philippines and the lives of the people. People lost their jobs and places like small resorts, beaches, and etc. were closed down to prevent the viruses to spread further. Later this year, vaccines were created and provided to the whole world. These vaccines are have antigen which will be injected to the human body in order to produce antibodies to improve the immune system in order to fight against the actual pathogen. And because of this, jobs, business, and other tourist attractions are slowly opening again. However, the government required to everyone to be fully vaccinated if they wanted to be accepted to their jobs, open up their business, and go to other places. COVID-19 is known to spread much faster than any diseases and other viruses. That's why, in my opinion, vaccination is truly important in order to stop the increasing of rate of COVID-19 cases, lower the chance of getting infected by others, and in order to help the people to go back to their work and travel again. We need to be fully vaccinated because vaccines protect us from serious diseases, and some can also help contain the spread of disease, saving around 2 to 3 million lives every year. Many of us receive this vaccine from diseases such as measles, meningitis, and pneumonia. As a routine childhood immunization, this has led to these diseases becoming less common or even eliminated in areas with high level of vaccination. Some diseases have a potential to be eradicated, as smallpox was in 1980. But because most can exist in animal or in the environment, from example in the soil, they pose an over-present threat, which is why it's so important that vaccination coverage remain high. Whenever vaccination level drop either because of high high consistency or when services are disrupted, these deadly diseases can quickly rebound. The life-saving power of vaccination is a major reason why global health organizations like Gavi are working hard to get vaccine out of low-resources areas, where vaccines are either unaffordable or inaccessible, even in countries where the risk of infectious disease is low. Getting vaccinated is still important in order to protect vulnerable people who can't be vaccinated, such as people with compromised immune system like those with cancer, HIV or AIDS, or people with extreme allergies. In addition, vaccines are not always effective in triggering a robust immune response in elderly people who may be more vulnerable to disease, and so widespread immunization is critical to protecting them.
Thank you, Mr. Fernandez, for that wonderful statement. Ms.Acid, the floor is yours.
Leaving home or going to work after vaccination, it can take effect and actually take several weeks for the body to develop immunity against severe acute respiratory syndrome's coronavirus, the virus that causes COVID-19. So it is possible for a person to become infected with severe acute respiratory syndrome's coronavirus before or after vaccination and still get sick with COVID-19. This is because the vaccine does not yet have enough time to provide protect. Only 95% is the highest percentage we will be protected by the vaccine, and the COVID-19 vaccine only protect against the severe acute respiratory syndrome coronavirus. It, it so it is still important to keep yourself healthy and well because you can still let us infected or infected. According to research, it is not enough for one person to have the vaccine against COVID-19 to allow everyone to come back work, school, or go to grounded places. Because if this is enough, we should go back to normal immediately, but the government will not allow us to go back to normal because of the 112.5 million population in the country. This is only 68.9 million full vaccination with 44M still not ready for mandatory vaccine. Begin implemented COVID vaccine only help to prevent seriously illness, hospitalization, or death from COVID-19. According to the study, even if you have a vaccine outside of COVID-19, you can still be infected. And if you become infected, you can also spread it without your knowledge because you don't notice or you don't feel very bad for me. You will force me to stay to go out. So let not rule out the possibility that it won't spread, especially since all vaccination people will be allowed to go out in grounded places.
Thank you, Ms. Acid, for that wonderful statement. Okay, Ms. Acid, do you have any questions to Mr. Fernandez?
Yes, I have a question for Mr. Fernandez. If you feel protected, why some of your country is still DCQ?
I will give you 2 minutes to answer, Mr. Fernandez.
The answer for your question, Ms. Geraldine, is because many people do not want to be vaccinated and do not follow the government that everyone should be vaccinated. So until now, GCQ is still us in our country. If everyone is vaccinated, the infection of viruses and bacteria will be prevented. Another reason why other places are still GCQ is because there are another variant of virus that is spreading. And if other people don't get vaccinated, I think everyone will be more affected, so we just have to follow the government that should all people in our country will be completely vaccinated. And because it's for our own sake and for our safety.
Okay, Mr. Fernandez, do you have any question to Ms.Acid?
Yes, I have a question. Thank you, Ms. Moderator. My question about your statement, Ms. Geraldine, is how can you work and travel if you don't get vaccinated?
I will give you 2 minutes to answer, Ms.Acid.
Mr. Fernandez, this is my answer to your questions. There are many ways for you not to be able to work for or travel. That is way Gmeet, Zoom, and others were invented to be a way for you not to be able to travel anywhere, especially since we are here during the pandemic and for us to prevent the spread of COVID-19. So during a pandemic, the public is recommended to using Zoom, Gmeet, or others.
Thank you for the informative and interesting talk for our first batch. Ms. Ogsila, the floor is yours.
Mandatory of vaccination for COVID-19 is ethically justified if the threat to public health is grave. The confidence in safety and effectiveness is high. The expected utility of mandatory of vaccination is greater than alternatives like home remedies and self-medication. I will elaborate on these brief suggestions and provide an obstructed algorithm when vaccination should be a mandatory. Mandatory of vaccination has a superior cost-benefit profile compared with the other alternatives like home remedies and self-medications. Vaccines are safe and effective. Vaccines are one of the greatest medical accomplishment and the cornerstone of the public health. There is an ethical balance to be struck introducing a vaccine early and saving many more lives from COVID-19 to be maximally effective, particularly in protecting the most vulnerable in population. Vaccination would need to achieve a herd immunity. COVID-19 vaccination can prevent us from having serious symptoms and various factors. The exact percentage of the population should have vaccinated that would need to be immune for herd immunity to be reached the safety of our nations. Vaccines can prevent disease that can be dangerous or even deadly. Vaccines greatly reduce the risk of infections by working with the body's natural defenses to safely develop immunity to disease. Vaccine can help us to protect the people by producing immunity to our body.
Thank you so much, Ms. Ogsila, for the informative statement. Ms. Kutaran, the floor is yours.
Mandatory vaccination for COVID-19 are not good to health of some Filipino peoples. It because the effectiveness of vaccine into human body are not even sure if we can be sure if we can be cured and survive into that COVID-19 virus. Some Filipinos are protesting their right due to the decision of the government of declaration of mandatory vaccination. And some Filipino are doing a fighting for no mandatory vaccine because the facilities of being infected of COVID are not into good condition. The food they serve are not even enough and vice versa. That needs of people are can't provide and fulfill and some other than that the antidote are not even safe, not that is by the laboratory. And the benefits of this vaccine into our body is to make our rashes, red spot, red eye bleeding to our nose, and also we can have fever when we take this vaccine. And also the possible outcome of this COVID vaccine antidote is to make our immune system low and can't accept for our body. We could be paralyzed, stroke, and other symptoms. The negative effect of these are possible mild damaging in our brain and other external organ of our body. The mandatory vaccination are not even good or can't help to save a million lives of people. But we are like their testing woman, figure of justify in clear if their invention of vaccine are working. And for the declaring of mandatory vaccination are meaning for taking away our right to choose to what we have can do. And the bad effect of this our body are can make lead to our death.
Thank you so much, Ms. Kuteran, for that wonderful statement. Okay, Ms. Kuteran, do you have any question to Ms. Ogsila?
Yes. Ogsila, how could you say that home remedies and self-medication are not more effective than having a vaccine?
Ms. Ogsila, I will give you 2 minutes to answer.
Thank you for that question, Ms. Kutaran. Firstly, there is no evidence or scientific evidence suggesting natural remedies such as consuming honey, ginger, or lemon are effective at preventing or curing COVID-19 virus. Reuters has debunked many false claims about bogus preventive methods and treatments for the novel coronavirus, including steam inhalations, vitamin C and E, baking soda, and lemon juice, and other herbal medicines. Secondly, vaccines prevent symptomatic and severe effects of COVID-19 by creating an immune response against the SARS-CoV-2 virus. Pfizer's primary efficacy analysis published in November 2022 showed its vaccines was 95% effective against COVID-19. Moderna filed the efficacy at the same month of 94% of effectiveness, and AstraZeneca's results in February 2021 showed 76% effectiveness after the first dose and 82% after the second dose. Thank you.
Ms. Ogsila, do you have any question to Ms. Kuteran?
Yes, I have a question. How sure are you that after having a vaccine, it can make a harmful and negative impact on your body?
Ms. Kuteran, I will give you 2 minutes.
In my point of view, not all vaccines are good in human body. or after taking that will accept of our body, because not every individual can take vaccine. Some of them are having an allergy or having sensitive skin lead for them to have a rashes. And sometimes when they take other medicine that not consult to the doctor might affect to their health condition. The negative effect after taking other medicine sometimes lead our life might give us a difficult result.
Thank you for the informative and interesting talk to our second batch. Ms. Melanie Mangaring, the floor is yours.
Thank you, Ms. Jocelyn. Good day, everyone. I'm Melanie Mangaring, BTTE-FSMC. From the affirmative side, this is my statement. It is necessary to consider the mandatory of COVID-19 vaccination for the people to stop the number of COVID cases in this global health crisis. The COVID-19 pandemic has changed the world due to the nature of the virus, particularly how it is transmitted. It has altered the human behavior, lifestyle, businesses, and has profound impacts on economic situation. COVID-19 appears to be affecting poorer communities and also the consequence of the measures taken by the states to control the spread of the virus, primarily by the controlling the movement of the people through community quarantine, lockdowns, and curfew in many parts of the world. The abnormal situation happening, but still, it is not enough. The cases of COVID-19 has risen to 10,343 with 685 deaths and 1,680 recovered as reported in the Philippines by the Department of Health, and this ranked our country as a third place after the Singapore and the Indonesia on the number of COVID-19 cases in Southeast Asia. Now, most vaccines had been used for decades with millions of people receiving them safely every year. As with all medicine, every vaccine must go through extensive and vigorous testing to ensure it is safe before it can be introduced in our country's vaccine program. These are preclinical experiments for the volunteer, the phase 1, phase 2, and phase 3 trial. They are all successful aside from using animal testing. So, it is ethical, the mandatory vaccination, because of the World Health pandemic that everyone affected, the kids and the elders. It is used to provide herd community that protects an individual and its community. As a legal basis, there is World Health pandemic that President Rodrigo Duterte signed and announced for the community quarantine and mass vaccination. As March of 2020 continued to May to decrease the spread of virus and the numbers of deaths. The main function of this coronavirus vaccine is to serve or develop antibodies and immune system response in order to lessen infection and transmission of this virus. There are options for vaccine that needed for the kids and adult or the seniors, according to their age like and with people mild health condition, with the advice of their doctors, they can choose what vaccine they are taken. For example, the Pfizer, the Sinovac, AstraZeneca, Moderna, Johnson & Johnson. So they can choose kung ano ba talaga ang pwede sa mga matatanda at bata. Kung natatakot man sila magpa-vaccine, pwede naman kumuha ito ng recommendation for their doctors. Meron naman mga tao na hindi pwede. Pero one vaccination in a family can serve the health of the community. That would be all my statement. Thank you.
Thank you so much, Ms. Mangaring, for that wonderful and informative statement. Ms. Gercan, the floor is yours.
Okay, Miss Melanie, as what you've said. COVID-19 risen to 10,343 with 685 deaths and 1,680 recovered as reported in the Philippines by the Department of Health. It's because of people who are not following the law and hindi mo maaaring isisi ang lahat sa kasalanan ng iilan lamang. We're in pandemic. Not all people are safe to vaccine. We have different health conditions. If you're healthy, then good for you. What about the others? You shouldn't be self-centered in this pandemic. We should fight as one. And also, you said that most vaccines have been used for decades with millions of people receiving them safely every year. Did you know that, based on studies of MU Health Organizations, COVID-19 vaccine-related fatalities exceed 6,000%, 6,000% increase in reported vaccine deaths in the first quarter of 2021 compared to first quarter of 2020. A fact that COVID-19 vaccine mandate is being introduced for health and social care workers in the Philippines. And for those who are refusing to comply, will either be redeployed or employment terminated for them. Did you know that in the 1987 Constitution of the Republic Act of Philippines, Article number 3, Section 1, no person shall be deprived of life, liberty, or property without due process of law, nor shall any person be denied the equal protection of the laws. We argue that COVID-19 vaccination should not be mandatory for these workers for several reasons. First, it ignores their genuine concerns and fails to respect their moral, integrity, and bodily autonomy. Second, it risks causing psychological reactance, potentially worsening vaccine hesitancy. Third, a mandate could have a significant negative effect on service provisions. Fourth, waning immunity and new variants mean that booster does not increasingly likely to be regularly required, meaning that what constitutes being fully vaccinated will be a constantly shifting target. And finally, vaccine mandates may have an adverse effect on health and social care recruitment. We argue that daily rapid antigen testing is a viable alternative to a vaccine mandate that is non-coercive and fair. This could be also supplemented by monetary incentive to be vaccinated. If there is no specific law requiring a person to be vaccinated, individuals, businesses, and service providers are encouraged to obtain a legal advice about their own specific circumstances and to carefully consider a position of vulnerable groups in the community before imposing blanket COVID-19 vaccinations policies or conditions. This may have unintended consequences, particularly for some people with disability, and may also breach federal discrimination law.
Thank you so much, Ms. Gercan, for that informative statement. Ms. Gercan, do you have any question to Ms. Mangaring?
Okay, Miss Melanie, my question is, how can you say how safe COVID-19 vaccine is? And why do you think the numbers of fatalities is increasing yearly?
Ms. Mangaring, I will give you 2 minutes to answer Ms. Gercan.
Yes, I believe that COVID-19 vaccines are safe and effective because it is developed using science that has been around for decades, and it prevents people from severe illness from this coronavirus. It has many trials or experiments before the finalization, so that is why it is proposed. It has a preference from the previous SARS and H1N1. Marami na tayong pinagdaan ng pandemya. Bakit hindi pa tayo matuto kung anong mga dapat nating gawin? Marami ng pinablik na impormasyon about sa COVID-19 vaccine upang magkaroon tayo ng safety guidelines sa ating mga gagawin at pagpipilian, lalo na kung may mga health condition ng isang tao. Tulad ng Pfizer, it has shown that 95.3% effective by the FDA. Tumataas ang mga kaso ng bilang ng COVID-19 at ang bilang ng mga namamatay dahil sa hindi nasusunod ang mga safety protocols ng ating pamahalaan, at dito rin nagkaroon ng diagarang proteksyon na nabigyan ang mga tao dahil sa nagkulang ang vaccine, dahil sa pag-aagawan ng mga bansa dahil nga sa world pandemic at dahil sa katigasan ng mga tao. Kaya lumala ang mga sitwasyon at bilang ng pagkakaroon ng COVID-19 cases sa ating bansa. Yes, ang pagbabakuna ng isang healthy na tao ay hindi masasabi na self-centered na desisyon, dahil nga ito ay nakakatulong pa upang maiwasan na makapag-spread ng virus kung magkaroon man, lalo na sa mga nakasalamuhan natin sa bahay. Kung meron tayong kasamang matatanda na may mga sakit, hindi ba natin natutulungan sila maproteksyonan, ang mga buntis o kaya mga kabataan? Ang pagkakaroon ng vaccine ng isang miyembro ng pamilya ay pagkakaroon na rin ng immunity para sa community. Yun ang tinatawag. Thank you.
Okay, Ms.Mangaring, do you have any question to Ms. Gercan?
Thank you, Ms. Jocelyn. Yes, I have the proposed question for Mr. Gercan. How can you sure that you were safe and will not be the cause to spread the virus to your community without taking the protection of this vaccine?
Ms. Gercan, I will give you 2 minutes to answer Ms. Mangaring.
By following the laws without mandatorying the vaccine, like social distancing, wearing mask, and sanitizing. That's all. Thank you.
Thank you so much for the informative and interesting talk to our third batch. For our fourth debaters, we have Joshua Tana. Joshua Tana, the floor is yours.
There are many studies that the vaccine is true and still effective in protecting against COVID-19. And this is the only way to reduce those people who get sick and infected with the virus. Vaccines reduce the risk of COVID-19, including the risk of severe illness and death among people who are fully vaccinated. In addition to data from clinical trials, evidence from real-world vaccines effectiveness, studies shows that COVID-19 vaccines help protect against COVID-19 infections with or without symptoms. Vaccines' effectiveness against hospitalization has remained relatively high over time, although it tends to be slightly lower for older adults and for people with weak immune system. COVID-19 have proven to be safe, effective, and life-saving. Like all vaccines, they do not fully protect everyone who is vaccinated, and we do not yet know how well they can prevent people from transmitting the virus to the others. So as well as getting vaccinated, we must also continue with others' measures to fight the pandemic. The more a community is vaccinated, the more we will reduce the incidence of transmissions, new infections, hospitalizations, and death. With more people vaccinated, the risk of viral spread declines, and even those unvaccinated can be protected. COVID-19 vaccines reduce transmission, ultimately slowing down each time the virus jumps from one person to the next. The less the virus jumps, the less opportunity it has to mutate. The less opportunity it has to mutate, the less concern that it may evade vaccine, and thus immunity.
Thank you for that statement, Mr. Tana. Ms. Garcia, the floor is yours.
Good day, everyone. The mandatory vaccination for COVID-19 has the confidence in safety and effectiveness, but it can also have a threat in public health. The COVID-19 vaccine was developed way through the years, various technology, and modern laboratories. But then again, no country has even produced vaccine that is 100% safe and effective. Please here emphasize the negative effects of having vaccination. First, the risks that are likely to be greater than the well-established vaccines that took years to develop. Second is that it has some different side effects to different individuals that may take early or may take time to manifest that we'll never know. Many people have various health problems, are afraid to get the vaccine because of that reason. Most affected by there are elderly. Lastly, so far, cases of deaths are related to the virus, and some are related with one vaccination itself, as shown it in the result of critical trials. More serious or more lasting side effects are possible. Report says that it may lead severe allergic reactions such as anaphylaxis. Mentioned it is rare but we'll never know. Vaccines are continually monitored to detect adverse events. Experiencing side effects or getting vaccinated is a part of the process, but is experiencing it has the same symptoms with the other disease. Other people are afraid to hospitalize because of that reason. Based on some articles, upon receiving the vaccines, a person should be requested to stay 15 to 30 minutes at the vaccination site, so health workers are available in case of any immediate reactions. Individuals should alert their local providers following vaccination if they're experiencing any unexpected side effects or any other health events, such as side effect lasting more than 3 days. Mandatory vaccination it is not such a good option, but let the people decide or with no hesitation. After all, it is their own well-being and their own safety of their own health. That's all of my side, Mr. Joshua and Ms. Jasmine.
Thank you so much, Ms. Garcia, for that informative and wonderful statement. Ms. Garcia, do you have any question to Mr. Tana?
Mr. Joshua, is the mandatory vaccination justifiable when there are both benefits to individual and in terms of preventing the spread of virus in the community?
Mr. Tana, I will give you 2 minutes to answer Ms. Garcia.
No, there is no benefit that a person can receive when he is vaccinated. His only benefit is that he already has protection against the virus, that he can no longer be infected.
It is really effective than having better alternative?
No, only vaccine can prevent or reduce COVID-19. If there is anything more effective than vaccine, why not? Right now, only vaccine can really reduce those infected with the virus.
Is one individual cannot decide for themselves to get vaccine for medical reason?
How can you say that the vaccine can be bad for human health when most people get vaccinated and nothing happens to them?
Mr. Tana, do you have any question to Ms. Garcia?
Yes, I have a question. There is no proof that the vaccine has bad effect on humans. So why did you say that there is threat to the human body?
Ms. Garcia, I will give you 2 minutes to answer Mr. Tana.
Actually, there is. Because before and after you given the vaccine, the doctors or nurses inform you the effect of it. Mr. Joshua, you even signed a waiver before injecting the vaccine. So, you do not believe in what they're saying? Did you think they are liars?
Yes, I have a question for Miss Maybe. If people don't want to be vaccinated, how can the virus be stopped?
It is part of the human right to refuse if they don't want to get the vaccine. As I mentioned earlier, they know their own bodies. They know their own health. They will know if the vaccine will be safe for them. Simply by following the safety protocols implemented by the officer. After all of us follow it and do not disobey it. It will lessen the affected once until the vaccine has studied well, and they can take care of themselves and do a healthy living.
Yes, I have a question for Miss Maybe. If vaccine had side effects that can harm to the human body, what are they?
Ladies and gentlemen, finally, we've come to end part of our presentation. We would like to say thank you to our debaters for the informative, interesting talk and wonderful question and answers. Hopefully, the presentation will be beneficial for everybody. Once again, I am Ms.Barona, your moderator. Thank you so much.